So let's talk about your vagus nerve. Your vagus nerve is part of your autonomic nervous system. As such, it is responsible for innate immunity. Innate immunity is something that you're born with. It's recognition of self over other, so that you can utilize that strategy to determine, is this cell mine? And if it's not, then we don't need it, so let's kill it. So the vagus nerve can be very important for various reasons. Everybody's heard something about the vagus nerve. The vagus nerve, though, what some people don't know is that it has a left side and a right side that have different functions above the diaphragm, or above the structures that touch the diaphragm. So the left vagus nerve is the one that makes you feel nauseous. The right vagus nerve is the one that actually makes you have reverse peristalsis, or upchuck. So the understanding the vagus nerve is very important, and like I said, especially above the diaphragm, from any structure that touches the diaphragm up, that vagus nerve really has very different functions. For example, left vagus nerve slows down the heart. Right vagus nerve speeds up the heart, along with the sympathetics. So you can see that there's a difference in that function. Now, what does this mean for you? Well, one example would be for people taking Ozempic shots. Some people say, well, I really lose a lot of weight quickly, or I don't lose weight very quickly. Or people will say, I get so nauseous, I had to change where I take my shot. So sometimes people aren't considering the underlying neurology and how that vagus nerve flows and how it functions when they're taking their Ozempic shots. So, for example, taking the Ozempic shot in the left arm, because that's more left vagus nerve dominant, is going to cause you to be more nauseous, and that's going to improve the desire to not have food, or it'll keep down the desire to have food. Right, the satiation reflex will stay higher if you take your shot here. However, that also means you'll be more nauseous. So sometimes people are too nauseous, and so their physician may recommend they take their shot in a different place, but how do you know where? So if you take it in the right arm, then you're going to be less nauseous, but your motility might be ramped up. So food might go shooting through you a little faster. So that's because that right vagus nerve is going to say, hey, let's move everything, let's make everything move. So it'll increase digestion rates. So say you have a slow gastric emptying. That might be the right side that you'd want to take that medication in. Now, this let's say that somebody wants to have they want the least nauseousness, but still have some increased gastric motility and still maintain some level of satiation and lack of desire to eat. So the right hip and abdomen is still left and right vagus nerve, or down here. Now you come down into this right lower quadrant, but by taking that shot there, that will cause you to still have some nauseousness, decrease your desire to eat, but continue to move stuff through your system. So that's kind of a best of both worlds. However, say that you're really sensitive to the Ozempic, it's just too powerful, too nauseous, or too quick of gastric emptying and GI feed. You would want to do it in your left lower quadrant, because the left lower quadrant has no vagus in it. Actually, the pelvic parasympathetics take over the left lower quadrant, because that's where the hindgut is. So the left vagus, the vagus nerve innervates the foregut, the midgut, but not the hindgut. And the hindgut starts at this just left upper abdomen and goes down all the way to the bottom into the pelvis. So that's little to no vagus input in that bottom left. So if you want to slow down the gastric emptying or the GI tract feed, the rate at which it's going, and decrease the nauseousness, your left hip, lower abdomen are the best place to take your Ozempic. Similarly, if you're taking an immunosuppressant and it's an injectable, let's say, that's not just like, oh, it's going to affect my whole area equally. Where you inject it has something to do with it. So, and again, understanding that if you have it here, you're going to have a much more immediate response, much more symptomatic response of your, and basically, if you're having lots of high symptoms, taking your left side would be a good idea to really suppress everything down. Right side, if you're having motor problems, like again, you're having loose stools or things like that, then the right side. If you're having too much of those two symptoms, but you still want to have some of that to really inhibit those symptoms, lower right. But you have to determine, like, why do you have an autoimmune problem? Is it a pelvic parasympathetic problem and not a vagus problem? Right? Vagus is going to be this upper body, lower right body versus pelvic parasympathetics. It's going to be lower left just to the abdomen or to the diaphragm. So you need to understand that neurology, where those nervous systems kind of overlap and touch each other and come in contact, and how that's going to affect the medications you're taking. So it gives you an idea of the injectable medications for sure, but just things going on in life. For example, immunization. Are you always getting your immunizations in your left arm? Then that's going to change what problems you have. One of the things I've seen is that people later in life get frozen shoulder, and one of the problems they'll have is that they've had too many injections in this area, especially with the newer mRNA vaccines. They really cause a large immune response here in the shoulder. So understanding exactly what it is we want with where you're injecting, what you're doing, they're very important. And so if you have a little bit better understanding, that will help you help with your own care. Hopefully that helps.